Welcome to this series where I'll be discussing the 2026 ACC/AHA guideline on the management of dyslipidemia. This is Endo in a Bite, where I break down endocrine concepts or lengthy guidelines into focused, high-yield pieces you can actually remember. For the full board-centric framework, I've built it all out in easy endo prep designed to keep you efficient, current, exam-ready, and sharp in clinic. Visit www.ezendoprep.com to enroll in the full course or start your free trial. Today we are going to continue with the table that we were discussing last week, lipoprotein goals for cardiovascular risk reduction. We discussed primary prevention and how less than 10%, the goal was 100, 130, 90, and 10% or above is 70, 100, 70. Hopefully you have the goals memorized. You've listened to the audio aid if that helped you. It is imperative that you remember low risk 100, 130, 90, high risk 55, 85, 55. Everything in between is 70, 100, 70. Last week we talked about primary prevention. Now I'm going to the second line, severe hypercholesterolemia. Here, if it's a very good situation, the good severe hypercholesterolemia, meaning there's no family history, no cardiovascular risk factors, and no subclinical atherosclerosis. Here, the guidelines say lipoprotein goals are 100, 130, 90. Then we go to the other extreme. Who is included in the 55, 85, 55? They are the ones with severe hypercholesterolemia or heterozygous familial hypercholesterolemia with clinical atherosclerotic cardiovascular disease. Who falls in the middle? Who is the 70, 170? That is the hypercholesterolemia with family history, with atherosclerotic cardiovascular disease risk factors, or with subclinical atherosclerosis. Again, if there's subclinical atherosclerosis without family history or risk factors, we go for 100, 130, 90, and subclinical atherosclerosis with family history or with risk factors, we go for 70, 100, 70. Again, if it is heterozygous familial hypercholesterolemia with atherosclerotic cardiovascular disease, that's when we are going for 55, 85, 55. Third category is diabetes. And here we're talking about diabetes, but no cardiovascular disease. So without ASCVD risk factors or diabetes-specific risk modifiers, here we're going for 100, 130, 90. And with diabetes, with risk factors, they could be cardiovascular risk factors or diabetes-specific risk factors. That is when we go for 70, 100, 70. The guidelines say if there's no cardiovascular disease, even in the diabetic population, we are not going to go for 55, 85, 55. All right, the next category is subclinical atherosclerosis. And here, if the CAC is 1 to 99, that's when we do 100, 130, 90. If it's above 1,000, we do 55, 85, 55. Everything in the middle is 70, 100, 70. 100 on one side, 1,000 on the other, everything in the middle. Now coming to hypertriglyceridemia. If it's a young patient, less than 50 years, no risk enhancers, that's a pretty good scenario. We go for 100, 130, 90. On the other extreme, if it's hypertriglyceridemia with clinical ASCVD at very high risk, we're going to go for 55, 85, 55. apoB goal is going to be less than 55. Anything in the middle, 70, 100, 70. So that does include with clinical ASCVD, not at very high risk, apoB goal less than 70. It also includes age 40 to 75 with equal or more than one ASCVD risk factor, apoB goal less than 70. Lastly, we come to the clinical ASCVD group. Here, it will either be 70, 170, or 55, 85, 55. So, at very high risk, with CKD, we will choose 55, 85, 55, and with clinical ASCVD, not at very high risk, goals will be 70, 100, 70. I would recommend you to listen to this episode with this table in front of you so you can visualize and understand. But the bottom line is, in a really good scenario, we choose 100, 130, 90. In a worst case scenario, we choose 55, 85, 55. Everything in the middle is 70, 100, 70. And again, like last episode, I included a memory aid, a song, a jingle to help you remember the lipid goals: 100, 130, 90, and then 70, 170, high risk 55, 85, 55. I have also placed a link in the show notes to the YouTube video, which makes these numbers even more memorable. This was another bite-sized episode of Endo in a Bite. Be sure to visit Easy Endo Prep at www.easendoprep.com to sign up for the weekly newsletter and get key clinical pearls delivered straight to your inbox. Let's get through this document, one bite at a time.
If it's 100, 130, 90, draw the line. Best case scenario, everything's fine. 100, 130, 90, smooth and slow. Low risk lane, that's where you go. If it's 55, 85, 55, hold it tight. Worst case scenario, fight the fight. 55, 85, 55, take control. Highest risk zone, that's the goal. If it's not 100, 130, 90 today, not that easy, low risk way. And not 55, 85, 55 alive, not that edge where you strive. Then it's 70, 100, 70, right between 70, 100, 70, steady and clean. 70, 100, 70, hold it tight, middle ground zone just right. 100, 130, 90, easy flow. 55, 85, 55, high risk goal. 70, 100, 70, center lane. 3 clean patterns, say it again. 100, 130, 90, say it clean. 55, 85, 55, lean and mean. 70, 100, 70, hit the scene. 3 number sets, lock the routine.
Get started today. Visit www.easendoprep.com to make your purchase now.